Hi, everybody. We are back with season 2 of the Dare to Be podcast. And thank you so much for joining us on this very special episode. We have Dr. Bridgette Wamakima. She is an assistant professor at Penn Med and an OBGYN. Thank you so much for joining us, Bridgette.
I'm excited to be here. Thanks for having me.
Yay. Yes. So, this is going to be a really, really big topic, especially for women in their late 20s, early 30s. And it's probably my favorite topic of the moment. So, we are going to talk about fertility, egg freezing, maybe a little bit of dating and relationships. So, let's just get into it. So, Dr. Bridgette, can you explain the basics of fertility and why it starts to decline in women as they get older, particularly in the 30s?
Yeah. So when we're born with a certain number of eggs. And as we age, over time, the remaining eggs and the quality of those eggs decline. And so it's not necessarily like anything a woman has done wrong. It's just over time, as you ovulate, you release an egg. And so you have less and less of those as time goes on. And
Mhm.
then the other thing is that because of that, also the ratio, not all of the eggs are like poor quality, but some of them can have more like abnormalities to them. So that's something that we start to think about in our 30s after decades of going through ovulation, releasing eggs, all that stuff.
So, you mentioned abnormality. Is this initially, or as the women get older, we start to notice more and more abnormalities in the eggs?
Yeah, so when I say abnormalities, one of the things that we think about is like aneuploidies or like things, basically chromosomal abnormalities, things like
Oh,
Down syndrome, all those things.
yeah.
So and yeah, so as time goes, we notice, and the exact reason for this is like multiple factors, but we notice that you're at higher risk of, your eggs being poor quality or having some of these chromosomal abnormalities as you get older.
As you get older. Got it. Okay. And thanks for going over that for us. I know we've talked about the abnormalities, but there are also some misconceptions, right? Some things that people might have heard about fertility that may or may not be true, right? Because they're misconceptions. So, what have you encountered, especially among women in our 30s, as far as misconceptions?
Yeah, I think that two come to mind. One of them is that you can like outwork or like out like fitness. Some of it, you know what I mean? Like people think that, oh, I run every day, I do X, Y, and Z, so I'm definitely gonna have a higher fertility than another. And what we
Oh,
know
wow.
is that people's rates, so for like their fertility rates, there's a lot of factors that go into it, and some people have their AMH or their ovarian reserve, basically what I was talking about in terms of number and quality, go down faster than others. And then the other thing is that, we talk about IVF and we encourage people to start thinking about it, and it's an amazing tool and we continue to get better, but it doesn't necessarily guarantee a pregnancy.
Yeah.
There's a lot of people who go through, and you meet people who've gone through one cycle and they were able to get pregnant, and then people who've gone through so many and still, despite, they just haven't been able to conceive. So while we are much better than we were a decade or two ago, but
Yeah.
it's not like a magic wand to
Yeah.
pregnancy. Yeah.
Yeah, totally, totally understand. And I know you mentioned IVF, but let's take a step back here because I feel like IVF, and correct me if I'm wrong, but I feel like that would be probably maybe step 2 or step 3 because I'm thinking early 30s, if you're not dating, you're not in a relationship, but you want to make sure you can secure a pregnancy in the future or at least try to secure a pregnancy in the future. Can we walk us through the process of egg freezing, which is called oocyte cryopreservation? What are the main steps and how long does that typically take?
Yeah, so the first steps is basically you'll come in and you'll get labs, and also an ultrasound. The reason you get the labs is they want to know what like your ovarian reserve. So AMH is one of the blood works that we get, and also FS. Like we get a couple other labs. One to make sure that like some of the labs is to make sure that you're not like going through early menopause, but some of the other labs is to know what your ovarian reserve is and how they'll basically tailor your protocol based on this. The
Yeah.
other thing is their antral follicle counts, which is another. So all of these things, the labs and the ultrasound, which looks at your follicles, tell a picture to the fertility doctor about like how well would you respond. And then
Yeah.
after they get that information, they start something which is ovarian stimulation, which basically you get hormones injected, and so that to help your multiple eggs mature at the same time. So I can stop there, and then after we like they monitor your labs, then based on your labs, they'll decide when to do the egg retrieval.
Hmm. Yeah.
So
So
I mean, I haven't actually gone. This is what like I counsel my patients on what it's like, but
Mhm.
I haven't personally gone through it yet, but I plan to, yeah.
So I can say that I actually have personally gone through it. I've done 2 cycles of egg freezing, and everything you said, 110% correct. Yes, check mark everything. So first visit, there was blood work. They tested for STDs to make sure there wasn't anything crazy going on. And then they talk about, you know, insurance, pricing, medication, all that, nifty gifty stuff.
Yeah.
Literally first appointment. So it's a lot. Especially I can say I wasn't mentally prepared for it, for that initial conversation. I thought it was going to be more of like, oh, let's talk about egg freezing. Tell me what you're
Yeah,
interested in.
yeah.
It's like, nope, go right in. Let's start. Let's get this done.
I mean, my initial visit, maybe because I was an OBGYN, they were like, I'm sure you know all of this. So they were like, they went straight into the finances. And I think that's for me where I was like, okay, like I knew the medical part, but the financial portion of it is also
Mhm.
pretty like it's something to like really think
Yeah.
about. So yeah.
That it's definitely, I can say, is a drawback of freezing your eggs, especially in your early 30s. If you don't work for a company that has insurance that covers this under their policy, or if you don't have $70,000 just sitting in a bank waiting for your eggs to freeze, it's definitely a drawback. But there are some benefits, and can you walk us through what those benefits are?
Yeah, I think one of the biggest benefits is kind of like an insurance policy or the option. So I meet so many women who are like, I don't know if I want to have kids or I haven't met the right person and
Mhm.
I want to. I mean, the goal of egg preservation is to kind of freeze your eggs in time, not just like also like put them away, but you take the quality of the eggs where at the age that you're at. And also it gives you a chance to have a lot more eggs when you do finally try want to decide. So the benefit comes from reassurance, like an insurance policy of saying, even if now I meet someone in like 2, 3 years, 4 years, I have my eggs from when I was in my early 30s, and now I'm 39. I'm ready to. I met the person that your stores you have things available to try.
Yeah.
Yeah.
Yeah, definitely a huge benefit. And it doesn't put a lot of pressure on dating, right?
Yeah, yeah, that's the other thing. Like, I think it takes we as women at this age, we have so much pressure to be the superwoman and also find the right guy and all these things. And I think the feeling of being able to be like, okay, I have more time to really find someone I like really is like a relief. But also, I think it's like for your own psychological safety of not dating someone really fast, getting married, and then like not for it not working out. And
Yeah.
you really are able to have time to think about one of the biggest decisions in your life that you're going to make.
If not the biggest decision, right?
Yeah.
Because having a child with the wrong person, whoo,
And also having a divorce with the wrong person.
wrong person.
I'm
Yeah.
just like, that's like something that scares me for sure.
Yeah. So, speaking about that, some of the emotional considerations, obviously, we mentioned psychological, but I can actually talk about my experience and then I'll
Yeah.
ask you what your thoughts are on that. So, emotionally, for me, when I went through the process the first time around, I was just trying to figure myself out. I wasn't really sure what would happen. But the second time, oh my gosh, all the emotions hit. It was like, oh, I'm gonna die alone. There's no one here for me. That's why I'm, you know, trying to save these eggs because I want to have a baby, but I'm not dating anyone. Like you have a lot of just obviously the hormones play a huge part. But what do you think some of like the emotional considerations that women should be aware of before deciding to freeze their eggs?
Yeah, I think what you described, one you're on a bunch, like, ton of hormones in order to trigger the fact that multiple eggs will mature. So on top of that, beyond just it being like hormone induced emotionalness, I think also like it doesn't always go the way people expect. And I think that
Yeah.
part can be hard. So just talking to other people or having patients who I've seen, like your goal or your hope is you get a ton of eggs and everything goes well, but sometimes that doesn't happen. And that is something that they may allude to or like hint at based on your labs and your ultrasound. But also, like, I've had friends who are like, oh, I think I only need one cycle. My labs were totally fine. And then they wind up having to need more. The cost of it, and also then you don't get a ton of eggs, can make you spiral even more if you are one of the people who didn't get the response you wanted. And so that is something to warn people about. Like, you may be doing this for security purposes, but it may trigger anxiety of like, is this gonna work? Am I ever gonna get a pregnancy? That kind of thing. So,
Yeah.
yeah.
That's actually a really good call out because I mentioned I did it twice. I had 2 cycles. So my first cycle, they were like, oh, wow, great. Lots of eggs. We're going to get this, 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 this. Amazing. They retrieved it and they retrieved a decent amount of eggs, but they weren't all mature.
Yeah. Hmm.
So pretty much they just looked at me as like the perfect specimen and, right out the gate pumped me up with all the all the drugs, right? And unfortunately, it didn't work out because I didn't have that many eggs frozen for the first cycle. And I also had to go through OHSS, ovarian hyperstimulation syndrome. So I had symptoms of that and it was really painful for me. And I didn't think I wanted to do it again,
Yeah.
right? But after a couple of months off, I thought about it. And with encouragement from the doctors, I was able to do a second cycle, which came out better for me. And because they saw what happened the first cycle, so they're able to tailor the meds the second time around. So unfortunately, it did cost a little bit more than expected, but thank God for insurance.
Yeah. But what you're describing is very common. So, like, the fertility doctors want to avoid OHSS. So they can, depending where you go, because like it is protocol, but some places may be more aggressive, some places may be more conservative. Even though labs and these sorts of things predict how you'll respond, not everyone does. So if they don't stimulate you as much, you might not get as much eggs because they were
Yeah.
conservative. If they stimulate you a lot, you might get ovarian hyperstimulation, which is not a fun experience. As I'm gonna have you explain what it's like, but so that also is the emotional aspect. It's like they're trying to find that perfect in between. And if they under, you are disappointed, and if they over, you're in pain and like
Yeah.
dealing with that portion of it. And not to discourage people, but just to show the reality of like what the experience is like.
Yeah. Honestly, I would still recommend it 10 out of 10 because, like you mentioned, it's like an insurance policy for your future, which you may not end up needing, but it's always nice to have. OHSS was not fun. I was literally just sitting down on the couch, I think it was the day after my retrieval, and I just felt just heaviness and pain. I'm thinking, okay, it's cramping, whatever. And then after a while, I could not even stand up straight,
Mhm.
unfortunately. So it was really painful and kind of just like it was a lot. So the second cycle around, they actually gave me medication to prevent that because it happened the first time. But then those meds ended up causing, this is a little bit TMI, but why not? Ended up causing constipation. So again, science is not perfect,
Mhm.
right? There are pros and cons, right? The pros are you get to, save your eggs in a possible pregnancy in the future. And the cons are obviously some, medication, allergies, or anything that could affect you in any way.
I just to add on to that, I want to make sure, like, without making people too nervous, that like OHSS is for the most part it's managed with pain management, watching you in the hospital, and then you'll get better and hope like things will simmer down.
Yeah.
Basically, it's like letting your body cool off, but it's
Yeah.
not like your ovaries feel like you feel super bloated, pain. You can experience pain. They get labs to make sure your labs are not abnormal, but it is one of the things but they will talk to you about it on your they give you the warning signs because it's
Yes.
one of the most common things that can occur. I can't remember the exact percentage of how many people, but it's not like we see so many people who have this to undergo egg retrieval and they don't have it happen, but
Yeah.
it is something that people should be aware of as like one of the common complications to like read about before doing this.
Yeah.
Yeah.
Yes. And my doctors were completely helpful throughout the entire process. There was an on-call doctor 24/7. So they were able to walk me through. And like you mentioned, it's after a while you kind of like readjust. So like that's why I was able to just relax for after a couple of hours and just, go to sleep.
Mhm.
So yeah, it's just your body reacting to, all the medication. It's because it's been through a lot, right? All
Right.
the hormones, the retrieval, which is technically a procedure slash surgery. So yeah, I survived it. It's not something that they don't tell you about. It's just something that could potentially happen.
Mhm.
Yeah. So thanks for that. And now we talked about egg freezing and the timing, right? We want to talk about what it looks like when you're dating as a woman in your 30s and why you might be struggling with the idea of not having a partner yet. And how I just want to know, like, how would you recommend balancing the pressure of fertility with personal goals and romantic goals?
Yeah.
And yeah.
So actually, they looked at that. They've done studies, and like, if you, a lot of things, it comes like down to age, and also if you are partnered. So if you are in your mid 30s, that this is around the time where you should think about it, like early to mid 30s, to about egg freezing. But if you're partnered and you're gonna get married and gonna like go down that path, it's actually more cost beneficial to try, especially if you feel like you're almost ready. So if
Mm.
you're like 30, let's say you're 32 and you feel like you're gonna marry this guy and try and by 35, it may those few years may not make a big difference. But if you're 33, 34, like I'm 34 and single, I'm like, okay, well, now as we're getting more and I don't have some like, I'm not married, then that kind of makes a difference of what you want to do.
Yeah.
Yeah.
Yeah. I mean, I am also 34 and single. So it's definitely something that, I think about, unfortunately, constantly daily, just because I do want to be a mother, right? I do want to have a child in the future. But I also don't want that to take away from my dating experience.
Yeah.
So that's another reason why I decided to do it because, like you mentioned, your eggs, as you get older, unfortunately, you start seeing some abnormalities.
Yeah.
And not to say that there aren't women that have children in, their mid 30s, late 30s without the abnormalities, but, it's just something we have to watch out for as we get older.
And I mean, this is like women in their 40s have spontaneous where they just get pregnant
Yeah.
without knowing. So like I think it's more like you just don't know what your life is going to be like, and if it's something you prioritize is being able to have this protection, then yeah, I would definitely
Mhm.
think about it.
So now let's fast forward a little bit, right? So let's say um I'm 34 now. Let's say I turn 35 and then I meet someone and we both don't have any children. So how would you, I guess, want me or at least advise me to start a conversation with this person about family planning and fertility? Because one, I do have eggs frozen, but whenever I would think if you tell a guy that you're potentially, looking to get married to that, oh, I have eggs frozen, they'll think, oh, okay, great, we have all the time in the world.
That
Yeah,
is,
so
yeah, I think it's about, well, I don't know, because now in our 30s, there are some men who are like, I want to be a dad. Like,
they sure do.
I'd be like, okay, like it's like a quick switch. Like when they're ready, it's like time. But I think it's a honest conversation to have. And also, there are people out there who have eggs, and they also just try, like, not try to conceive without
Mhm.
undergoing like an embryo transfer
Yeah,
first, because that also does cost money. Like, so
yeah,
people are like, let me just try. But um, I think if you really like someone having an open discussion, I think how they react is how they're gonna react regardless.
yeah.
I don't know. I'm curious what your thoughts are on this.
I don't know, maybe I feel like now I have all the time in the world.
Yeah, I think that would be my problem. I'm like,
It's
once
the
I get
problem,
the
yeah.
expo, I'm gonna be like, well, I can wait till 40, or I can get I gotta get my money up and maybe someone
Right.
else. I don't know,
At
but
this point, I'm thinking, yeah, you know what? Do I even really have to meet someone now? I don't know.
yeah,
No, but I would definitely like to have a child, sooner than later, obviously.
yeah.
Because the older you get, no, I can't run as much as I used to. I can't work out as often as I used to.
Oh, yeah.
So I
Well,
hear kids take a lot of energy.
and pregnancies become more complicated as you get
Yeah.
older. So like, I don't know. I'm like after 45, there's people who come and they like after they want to try at 45. I'm like, for me, I think I'm good. But that's a personal choice, I'm like, I don't know.
Yeah.
I probably have high blood pressure and all these issues. So like, yeah.
Yeah. I can definitely see that, especially you never know. Anything can pop up, right?
Yeah.
I want to also talk about fertility education for minorities, just because obviously when I was going through the process, I told my family members, but also just trying to educate her on it's not about, finding the right person, but it's more about just insurance and making sure I can have a child in the future. So can you speak on any unique barriers or challenges that, minorities, women of color face when it comes to fertility awareness or treatment options?
I do think one, like, truthfully, as we know, like, as Black women specifically, or like in general, one I see is financial barriers. I think a lot of people who I see doing egg freezing are from like affluent white backgrounds, and so like I think it's more normalized in their community. So one, there's also one because of financial differences, but also cultural differences. It's not like a lot of people, I don't really hear my coworkers or et cetera saying, "Oh, my mom told me not to," or they say, "Oh, I'm getting my eggs frozen," and then the parents, it's just like a normal, like, okay, like, they have a friend who've done it. They have a lot of people within the community they know who've done it, and I
Yeah.
think that amongst our like Black or women of color, there's not as much of us doing it, so it feels more like the sea of unknown.
Yeah. Yeah.
You're like, I can't, like, I can. A lot of my friends who have done it are my friends who are white or Asian, etc. And so I have people I can talk to, like, how was your experience? But if I
Mhm.
had to think about how many of my Black friends I know have done it, there's not as many. And then another barrier I think is religious.
Yeah. Oh,
I think
yes.
it's
Oh my
like,
gosh. You can pray to God. God will provide.
yeah,
Yes.
God will provide is a huge one, and it's like, oh, you don't have faith, and I'm like, no, it's not. It's just like science. It's just
Yes.
like
Yes.
science, and they don't go against one another. And also,
Yeah.
like, I've seen what the opposite spectrum where I take care of patients who are like my fellow African women who are late 40s, and
Mhm.
they still are like, I want to have a kid, and I'm just
Mhm.
like, oh, like, we can
Oh,
try, but
yeah.
this is gonna be really, really, and it's like their life dream, and now they're like ready to like put their all,
Mhm.
and it's
Yeah.
like I wish someone they had the conversations earlier about like
Earlier. Yeah.
those things because I can see how bad they want it, but it's just gonna be so much harder in your 40s than it is in your 30s. So
Yeah.
yeah,
And I know you mentioned about, just women, minorities, Black women not really having access to the information because they don't have too many people around them that
yeah.
have gone through the process. Are there any resources or support systems available for women of color who are actually interested in learning more about their fertility options?
Yeah, I would say, like for example, ACOG has like patient information. So like that's American College of Obstetrics and Gynecology, which is what we use as our Bible. But like that's a place if you just want to learn about like the basics. And I think that there's also a lot of creators, Black doctors, like Black
Yeah.
OBGYNs who've touched on this and are starting to talk about it. And then the other thing is I would say like you can make an initial consultation with going and making saying, "Hey, I want to get my eggs frozen," and having that initial visit does not mean you've said, "Yeah, I'm putting a
Mhm.
stamp down and doing it." It just means that they have so many people that they see who do an initial consult, come find out the information, and then they decide not to. You as a patient have every right to just go to your doctor or the fertility doctor and say, "I want a consult." And this doesn't an initial consult is just like any other office like visit. It's not
Yeah.
the thousands of dollars, but just to get of like what is this like, what are the concerns, and even like just getting the baseline labs and
Yeah.
ultrasound give you an idea, and just like that is not expensive, that's not the expensive part. So like if you wanted more information of like what does my ovarian reserve like, they're not going to tell you it's good or bad, like they're not going to put you on like a scale, but you can use that information to kind of gauge where you are. And if you have a very low AMH, for example, you might be like, oh wow, like I really need this is something I want to prioritize and put money towards. And I know people who've done that, like they get labs and they're like, whoa, I wasn't expecting it to be like this
Mhm.
low of a situation. I want to get on this now. And it's
Mhm.
much better to learn that early than when you're in your 40s and they're like, your levels are really, really low. We don't think you'll respond to anybody.
Yeah.
Yeah.
Yeah. That's a really good one. So ACOG, you mentioned American College of
Obstetrics and
Obstetrics.
gynecology.
Oof,
That's like
that's a
the
mouthful.
if you put ACOG, ACOG
ACOG, okay.
using that's a good I think that's what we use as our like patient and then you can just look at their patient information. But also there's a lot of like now there's growing information, YouTube. I mean
Mhm.
just check the sources of like what are the credentials, but like with anything, like if I want to find out about my good like I don't know, my hair or derm, I always check and see like who's this person that is telling
Yeah.
me about my skin condition. So yeah.
Just make sure it's a reputable resource, not fake news.
Yeah, not fake news, not and also not someone trying to sell you something on the
Yeah.
internet because like someone will tell you about your fertility and then sell you pills, but they're just trying to sell you pills,
The
you know?
pills. Yeah.
Yeah, yeah.
Exactly. All right. Now let's pivot a little bit. We were talking earlier about mental health and emotional impact,
Hmm.
and how fertility and family planning can be emotionally challenging, especially for women who are trying to make decisions on their own. So again, personally, I was overwhelmed because at a point I was like, am I doing the right thing? Should I have done this? Why am I doing this? What's going on? I don't have anyone to talk to about this except for my doctor. My family's like, wait, whoa, what?
Yeah.
So how can women take care of, I guess, their mental health while navigating the pressures of fertility concerns? Like, would you recommend therapy,
I would
yoga?
definitely like say get connected with a therapist on
Mhm.
the career side. Also, like these experiences aren't, it's one of the things is like feeling like you're doing something alone is what creates isolation and makes you feel sad. Like feel
Yeah.
like you're in this without anybody. At the same time, this is now, I think most recently, like 50% of women, it's like a flip of a coin. 50% of women in their mid 30s don't have kids.
Mhm.
So a lot of women that you see walking around,
Yeah.
whether you know it or not, are going through something similar. Not, I'm not gonna say all 50 who don't have kids want kids, because there's some people who make the intentional choice, but
Of
as
course.
you can imagine, that means there are millions of women who do want kids who haven't had them yet, who are still like thinking about it, normalizing it and realizing that what you're going through is not abnormal.
Yeah.
And then yeah, I think talking to a therapist and looking for one who specifically like talks to women in their 30s or understands this experience or has this clientele so that they kind of are geared towards that too.
Yeah, that's a good idea. And another thing I actually saw at my doctor's office, there were posters of like Facebook groups for
Hmm.
women that had children alone or women that were going through the process. But that's something that I think would have been beneficial for me while going through it. What I was doing was I was watching TikToks and searching up articles and things like that. But I think also just talking to someone who has either gone through the process or is currently going through the process would have been really helpful. And then come to find out after I went through the process the first time and I shared with some friends that I didn't tell before, they were like, oh, actually, I am familiar. I actually did IVF. And coworkers were telling me, oh, wow, my first baby was an IVF baby. So like just I feel like it's a conversation that we don't have just because of the stigma around it, right?
And I think like what you said, there's so many people who have gone through it or like every time I bring it up with someone, they're like, "Oh, I just made my first appointment." If you're in
Mhm.
your 30s, most likely than not, know a friend or two who's gone through it.
Yeah.
To comment on, I think it's good for Facebook forum and those Reddits, and that's good, but sometimes those forums are like a nest pool of like anxiety.
Mhm.
I see. So being cautious with that, just because
Yeah.
like we have patients who come in and I read this and I read that, and I'm like,
Yeah.
okay. And I have to like walk them down like
Yeah.
a
Yeah.
hundred
Yeah.
levels of anxiety. But I do think it's good for like basic, sometimes people like, what was your experience? And then reading like five of those and being like, okay, so like in general, it seems like this is the general experience of people. So yeah.
Yeah. For me, I thought the injections were gonna be the hardest part. It wasn't.
Yeah.
After the first day, you get used to those things. And I'm not scared of needles. And I don't know why I thought I was gonna be scared of injecting myself, but it was for me, it was like the mental impact and
Yeah.
just it was a lot of overwhelming emotions and having it all by a certain age, making sure you can have a child in the future and you're not dating, and it was a lot. So yeah, I think to your point, therapy would have been probably really helpful at that point. And then also maybe some sort of open forum where you can talk to a friend that might have gone through the process. And yeah,
Yeah.
no,
I was gonna say a lot of things are becoming normalized as we're in an ever-changing world, and even like you mentioned, like there's a big movement of like single by choice, which is like
yeah.
another way where people are like I'm financially ready and I'm ready to have a kid right now. So maybe egg
Mhm.
freezing isn't the best thing for you. Like if someone is like I don't need a partner, I just want a kid, like maybe that's the difference between like some people will go and get a sperm donation and become pregnant right then and there.
Mhm.
It's about like what do you want in your life and
Yeah.
like if that's something else like considering all your options and like considering adoption or considering what does being a mother mean to you is like something that's important to consider.
Yeah, I don't know, girl. I can't be a 16-year-old single mother. Because
Well,
at this point, I'm just a 16-year-old girl.
I feel like if I feel like if I'm gonna do that I probably would just adopt, but that's my choice.
Yeah.
Yeah, but who
Yeah.
knows where
Yeah,
life will take.
that's true. And I know people that have told me like, yeah, if I never met my husband, I probably would have, done the sperm donor route and just gotten pregnant because I really wanted to be a mother. And I was like, wow, kudos to you.
Yeah,
Because I can't imagine, raising a child alone. I can't even imagine raising a child with a partner. But, people just I love that determination for wanting to be a mother and, that maternal instinct.
yeah,
It's amazing.
yeah.
But yeah, different strokes, different folks.
Now that we have like so many options in this life, you kind of have to know what you want. Like,
Yeah.
what do you want out of this life? And you
Mhm.
have to think about that as a woman. Like, what does family planning or what does building your family look like? So, yeah,
So, some final thoughts here. Just looking at fertility treatments more broadly, I know we talked about IVF a little bit. What are some advancements in the field of fertility that you're excited about, particularly for women in our 30s? You also mentioned that we are better off than we were 10 years ago. So, if you want to talk about what those advancements are, what they look like, what you're excited for in the future.
I think that in general the protocols have gotten better. So, like, from what remembering in terms of like how tailored they are now and like reduce they've done a lot of research on how to reduce OHSS or done research on how to increase the likelihood of a pregnancy based on the number of eggs you have, those sorts of things. And I think that one of the biggest advancements, which is like bordering scary, but it's cool, is like how much DNA you can know about your baby. Like you can, I wonder where will we be? Like, would you know which color eye color the baby has or like what, those sorts of things. So, I think it's exciting to see. And also the other advancement I think will be cool over time is affordability. I do think
Mhm.
that there's a lot of people in the space trying to see where can we cut costs. So like a lot of the major costs is in the medications and then also like the procedural getting the retrieval. But there's a lot of companies coming out now. Like Femtech is getting a ton of money or like digital health where maybe you don't need to see a doctor or you can cut costs in like shipping the medications and I wonder where that space will be. Will it be affordable where all women in their 30s can afford it? Just like
Yeah.
so many other things. It's things like years ago costs 100,000 and now they cost like 5,000. So I think the other thing I'm most excited to see is that there's a lot of focus on making it more affordable. And I think once it is, it's going to be more accessible. And then I think that will allow people to really use it as a tool to like family plan and it's not going to like break your bank or your life savings or it's a a car
Yeah.
payment or something like that. Yeah.
Yeah, that's really exciting. I'm also really excited about the medication because that was probably the most expensive part.
Yeah. It's
Yeah.
the most expensive part. And like, just like with a lot of other medications, they get cheaper over time, which is like, I could go on about big pharma, but like when a patent is over and now it can be generic, what does that look like? And or like the same thing with GLP-1s, now they're everywhere, the a couple years ago they weren't, and like now they're cheaper, more accessible. So yeah, I think the same thing happened.
Thanks for bringing that up because I've been reading a couple of articles and I've heard some testimonies too
Yeah.
from people about when trying to conceive and they're on GLP-1s and it literally like makes them more fertile and they have a baby and they get pregnant really quickly. Any
I think
resources, anything?
that would have to go towards the PCOS crew. With what we know is that people with polycystic ovarian syndrome have insulin resistance. And what we also know, studies have shown that is like when you help control the insulin, it help improve insulin sensitivity, which some of the GLP-1s do, fertility rates also improve. So that's why
Mm.
it's like, and also weight loss. So when
Yeah.
people lose weight, they also see that they're able to get pregnant. And so the GLP-1s are making a change in like, especially the demographics, either who we're able to get pregnant and also we're dealing with obesity or PCOS. And also like there are medications now that help people specifically with PCOS to get pregnant that isn't egg freezing. So like the subset, and this is all because they're putting more money into funding research for women. Like
Yeah.
these things weren't being well funded before. So like now that they're funding this more, we're finding out more and really like I think in 10 years anyone, I mean no, I think that's an overstretch, but I was gonna say anyone who wants to get pregnant can, but like will get much better at helping people get pregnant if they really want to.
Yeah. Wow. Yeah. That's really exciting because when I heard it, I was like, what? That makes no sense. How can Ozempic make you?
Yeah, no, it's because it literally changes the way, like, not to be too sciencey, but like changes the way your body responds to some of these barriers to pregnancy. And so now that those barriers are improved, you people are able to get pregnant much easier. So, and that's something we didn't even know like 3 to 5 years ago. So
Yeah.
now
Yeah.
who knows what else we are gonna discover.
Science. Oh,
Yeah.
you gotta love it. There's always some new advancement. It's I
Yeah.
don't know, it's amazing. It's amazing.
I'm just scared about it. I and medicine.
Oh,
We'll see. That's a whole nother.
I always see like memes on Instagram or TikTok saying your future doctor is right now taking tests using Chat GPT. Yeah. But I'm sure they still have to go through, clinical and they'll learn a different way. Yeah. All right. So, what would you say to women who are considering egg freezing but feel hesitant, overwhelmed, just scared by the decision?
Yeah, I would say education tends to help alleviate a lot of that fear. And like taking the time, like we mentioned, avenues of how to get adequate information. Another thing is like reaching out to someone who you know has gone through it.
Mhm.
And then lastly, like make an appointment. An
Mhm.
appointment is not committal. It's not, doesn't mean you're gonna go through it. And like, yeah, you'll have to pay a copay, which is like not fun, but I think just getting in and talking to someone who does it every day and having them address some of your concerns is at least one step forward
Yeah.
in the direction of knowing. And also, if you go and you consider it and you decide it's not for you, that's also okay. You didn't
Mhm.
waste anyone's time. They get paid to do this, and that's fine. Like it's just like when people come for a surgery consult. Like I know some people will do it, some people won't, and that's fine. It's like what our job is here to tell you the information and for you to make the decision for yourself.
I will say this, I had no thoughts about it. I had a mentor who actually did egg freezing just because she had some health issues and she wanted to make sure for her future she was able to have children. So then I started thinking about it because years kept going by and I was like, wait, I remember so and so was telling me about egg freezing. So that's when I, made the appointment. But that first appointment, I wasn't expecting all that information to be thrown at me at all.
It might be, that's true. That the first appointment, it depends. Like it can be a little bit overwhelming, and that's
Yeah.
okay to be that way. Like just take the questions take some of that information with you, let it digest. Like
Yeah.
that's okay. Yeah.
Yeah. Yeah, I think that was probably the beginning of the overwhelming conversations and thoughts. But I think after the first day when they start the injections, things start to shift a little bit. You're like, oh, I'm actually doing this.
You feel like, oh, I'm happy I did it. Like
Yes. Yeah.
I like that tends to be how a lot of people feel, I think.
Yeah.
And sometimes even if like people like, okay, I had this many eggs, I only have two
Mm.
kids and I didn't use all of them. Like I do think them having that, or even people who don't ever like don't use them and still say I gave me a sense of peace. So like, yeah.
Mhm. I think I read this on some blog or something, but apparently if you have a 75% chance of having uh one egg fertilized out of like 14.
Yeah, I think the number's like 12. So you need you do need a decent amount of eggs in order, or what the number that comes is that they're quoting is how many eggs you need to like not guarantee, but to have like a high percent of luck.
5%.
And so yeah, it's not like, oh, I froze 4 eggs, I'm gonna have 4 babies. It's like, oh, I want to say it's 12, but I can't remember the exact number right now. But I have X amount of eggs, which guarantee is like 80 to like a 90 percentile of one live bird. So like that's why people like, as you mentioned, go through multiple cycles because you want to ensure like you have a decent amount to proceed. And also even after you get the eggs later, they do like genetic testing, and some of them were abnormal, but that is something that like you want to have a lot of them, so that reduces the risk of if you only have three and all three are abnormal, then you're not able to proceed.
So is the genetic testing done before the embryo transfer? Is it, or is it done right after the egg freezing, or when does that happen?
It's done after like it's testing of the embryo.
Okay,
Yeah.
got it. Okay.
Not everyone does it, but it's an option when people are trying to decide which embryo to transfer.
And I was told, so I'm a twin. I was told there's like a super, super slim percentage of having twins with, egg freezing, embryo transfer, stuff like that.
It depends. Like, yes, now because I think they've gotten much better with how much like eggs they do transfer. But yeah, like the initially the IVF was increased, and I still think you do have an increased chance of having twins compared to like a spontaneous birth. But also, you're Nigerian, and the Nigerians actually have a higher percent of twins subset. I don't know if you knew that, but yeah.
I did, especially I'm Yoruba, so especially Yoruba, like everybody in my family, there's at least every generation there's sets of twins. I have twin uncles. My mom has twin cousins. My grandma had twin sister siblings. Like
Yeah, there's like I forget there's
we
some
all have
area in
twins.
Nigeria that has like a really high percentage compared to like the general world population of twins. So it's like that's also like what you're mentioning, which is like there's like this history of twins, etc. But they used to do a lot more of like transferring multiple eggs, and then people used to have like triplets, and they've gotten a lot better just because once you start to have like multiple or multi-gestation or like basically ton of babies, it does increase risk of other things. So they've become like trying to minimize, like it's not, it sounds cool, but having like quadruplets is not good for you or for the baby. So yeah.
That make complete sense. And another question I have, as you get older, I also heard that the chances of having multiple children or releasing multiple eggs as you get older, so having twins, triplets, quadruplets, increases. How true is that?
That's a good question. I don't, I'm not actually sure about that. So I would have, yeah, I'd have to verify that. I don't know if I see that as like my daily experience of, it depends. Like if you were doing something to help get pregnant, then yes. Like, if you were with assistance, then yeah, you are more likely.
But
Yeah.
it's not something that normally that could potentially happen just because you're releasing more eggs as you get older.
No, I don't think like necessarily getting older, like being in your late 40s, etc., makes you higher risk of having like twins, unless you went through
I got
IVF.
it.
Yeah.
Got it. All right. So, as a final thought, what would you want women to know about their fertility and wellness that might not be hearing in the mainstream?
Um, I think one, it's normal to be having these thoughts, and we should continue to have a loud discussion about this. Also, your reproductive choices are it's the world is your oyster, and like you pursue it. And I think be proactive about what you want in this life in general. And I mean that about all things, but also if you want children, like if you want to have kids, take the actions to try and give yourself the best possibility of that. And while it's not a guarantee, I think that if that's something that's important to you, I think just like all other things, make it a priority. And there's nothing wrong with that, with you making something like that a priority.
Yeah. I agree. I agree. And for me, so I would say, just do some research,
Yeah.
have friends that are OBGYNs and talk to them about it, right? And, pick some brains and see if this is what you might potentially be interested in. Yeah.
I do want to add one thing we didn't talk about, but there are some places, some jobs that you can get. There's like it's online, and I think a lot of it is state by state. But like I think some certain jobs at Starbucks cover, like if you get that job, it will cut the I forget to what level or like the specific
Mhm.
parameters or like Costco. I don't know the specific companies, but I know it's online because I've sent the resources where like if you get
Mhm.
this job, they cover some of the like egg freezing, etc. And if you work a job you don't love and you're very flexible and this is something that's a priority to you, it's something to consider, like looking for something where egg freezing is a benefit. You know, like Facebook, I don't know, it does has really good benefits. I don't know what level you have to be working for them, but um that's another avenue where if you are like certain, because there's people who are like, uncertain, but they have the money, and then there's people who are certain, they just don't have the money, but there are creative ways, especially certain states where egg freezing is covered a bit better and it takes off some of that cost. So,
Oh yeah, I don't know if I mentioned this, but my company covered it. I
yeah.
think out of
My
pocket,
job covered it too, a good amount, which is
yeah.
where I was at training didn't. So like I
Mhm.
waited till I got here because they cover it's a huge barrier. And even if I was a doctor at both places, but it's like one place covers it and another
And
doesn't.
other stuff.
That wasn't my only decision, but once I heard, oh, they cover a good, like almost all of it, I was like, oh,
Mhm.
let's do it. So like that, I'm like, well, why not? You know?
Right? Exactly. Same here. My company, I found the benefit and I was like, oh, okay. And again, my mentor told me about it. And I was like, well, now I have no reason to not do it, right? Like I'm not coming out of pocket huge amounts, chunks of money that people are paying, right? Because they do want children. But because my company, my organization covered a huge amount of it, I don't know, I probably paid maybe a couple hundred
Yeah,
for meds or things, and maybe like 1,000 here and there for the hospital. But yeah, it's compared to the price tag, it's if your company covers it, and I feel like you have more to gain.
yeah,
So definitely look into it. Yeah.
yeah.
Yeah, that's a good one. I'm surprised. I figured like all doctors would have this as a benefit.
No, no. Shockingly, like a lot of unions are growing now because you're like, well, I just gave you my best years to train. Like, so a lot, it's becoming much more common, and I think even more businesses are starting to cover it. So, like, and also if you're not sure, go look at your benefits. They might be covering it, and you have no idea, and you're missing out on something that they're taking out of your paycheck anyway. So you might as
Yeah,
well
might
go
as well.
get your benefits. So
Yeah. And it was easy for me because I had already met my deductible. So I was like, hey, let's
let's
do it.
there's ways to work around the financial stuff depending on where you work.
Yeah. Yeah. I will say that like a lot of companies that do have that benefit, kudos to them. We need more.
I have a question for you. What do you, like, as someone who's gone through, what do you want people to know? Especially women, like Black women or women of color. Like, what is your
Yeah.
message?
Good question.
I'm turning it back on you.
So, what I want people to know, I feel like when I first looked into it, well, when I was told about it by a woman of color, so I was really open to hearing from her perspective, for
Mhm.
her hearing her perspective. So I think having the conversation, being vulnerable about what you really want, that will potentially, give you space to make the right decisions for yourself. I think for me, I wasn't vulnerable enough to talk about it with people that I knew because again, it's like taboo, or why am I doing this? Like, I have enough time. I don't want to have to go through this. And it also just like painted a picture in my head by saying, you're only doing this because you're single right now. So I think I will tell women that are deciding to do this for whatever reason, try to take away, that misconception of it's only because I'm single, but
Mhm.
also just try to make sure it's like a protection for you in the future. And if you're not sure if you want to have children, at least it's something you can,
Yeah,
potentially have as a keepsake. And I've told my friends too, the ones that, know about me going through the process, I've told them, hey, if you're not sure about having children, at least look into it.
yeah.
Because in the future,
Personally,
you
I'm still not
never know.
sure, actually, and I'm still like I'm personally not sure, but it is
Mhm.
something that I'm like at least I can have the security. And
Yeah.
I like the one thing you said. It's like I think a lot of women think Now I'm going through egg freezing. I feel like I failed because I didn't find someone fast enough and I
Yeah.
have to go through this process. But
Yeah.
I think we have to like destigmatize that, move away from it seeming like a failure and more of a protection of something you want that just hasn't happened yet, you know?
Yeah. And I think just going through the process, and you might start thinking or feeling that way, but now I'm on the other side. It just makes complete sense.
Yeah.
Makes perfect sense. Even honestly, I wish I would have known about this in my 20s,
Yeah,
right?
yeah. When I had more, I wish I had coverage went back then because
Yeah,
I had more time.
exactly.
I'm just now I'm like trying to find the right weeks to do this, which is like now I have the coverage. It's just about finding the time, which it'll.
Yeah.
I'm gonna probably yeah,
Yeah.
yeah,
So the younger you are here, they say the easier it is.
for sure. And also like you'll get you get more eggs, you'll better
Hmm.
quality, all those things. Now I will say when you're almost too young because of the fact that you might get married and have kids and etc. So like they don't people in their 20s don't need to be going and get from just because it might not be. I mean, a lot of people have different thoughts about this, but cost benefit analysis have shown that like
Yeah.
it may not be as beneficial super early, but it is growing amongst 20-year olds too. So yeah,
Yeah. When I went for one of my multiple blood draws and they ask you to just verify your name, age, there was, someone sitting next to me and I heard her age and she was like 26.
yeah.
I twisted my neck real hard. Like, wait, girl, what?
Especially when people have the money and they're like, well, I don't care about cost benefit. I'm just gonna do it. Yeah,
Yeah.
I mean, but
Yeah.
so
And then I also didn't want to say, well, she's too young or she might have, medical reasons for
yeah,
why she's doing it. I did notice the ring on her finger. So maybe she just,
yeah.
it's, yeah, you never know why people are doing what they're doing. And then
Medical,
obviously, I'm sure her doctor advised her.
yeah.
Mhm.
Medical reasons is another big deal. Like people have like, oh, maybe you have lupus or something that
Mhm.
affects you, like where your ovarian reserve. So
Yeah.
sometimes people just do it earlier for their own. And something, if you do have medical conditions, talk to your doctor and be like, does this affect my ovarian reserve? Should I be thinking about doing this earlier? Because a lot of people say mid-30s, but like if you do have other comorbidities, it might be earlier than that. So
Mhm.
yeah, for
Yeah.
sure. That's so true. So I'm glad you brought that up.
Yeah, I was surprised. I mean, she obviously wasn't a black woman, but
Yeah,
so like when I looked, I was like, wait, what is going on here? But then in my mind, I was like, wait, if you step back, there
yeah.
might be other factors. You never know. So
Mhm.
you have to just, obviously, her doctors advised her, and yeah,
Yeah.
yeah, good stuff. All right. Do you have any final thoughts you want to share with the viewers, the listeners, anything?
Follow me on TikTok. Because I'm trying to grow, like just talking to black women, talking to women, but specifically black women. I think we're in an age of technology and information is not far, and it's important to listen to people who know what they're talking about, but also want to, provide good information. So, and also thank you, Ivy, for having me on here. I appreciate it.
Thank you. It was almost like kismet. Literally, I was going through the process and I was like, okay, this is going to be the next episode. And
Yeah.
then I saw that you posted. I was like,
Yeah, I'm glad I mean, it took us a while to get here in terms of aligning schedule, but I'm glad we did it because I think it's an important thing for people to know about.
yeah, I think as long as we were able to finally get it done and get out the information. Yeah. But yeah, it's been such a great time talking to you, Bridget, Dr. Bridget. Yes. Thank you so much. It was such a pleasure having you on. Please visit us again. Thanks for tuning in to the Derby podcast. We'll see you soon. Bye.